Hertfordshire Community NHS Trust. Can I, for those of you that are in vision, could somebody just wave to make sure that you can hear me before I go any further? Brilliant. Okay, that's great. Okay. And I'm absolutely delighted to open today's meeting and to thank you all for joining us. This is my second AGM that I am presenting. And all I can say is it means so much more to me this year than when I started, because, you know, I'm beginning to understand all the different parts of HCT and admire all the hard work that everybody is doing. So it's a real pleasure today to be joined not only by our staff, but by some of our partners and members of the public. So if we move on, it's been a year, as I think every year is, of significant activity, collaboration and achievement. And I want to just give a big welcome to any of you that are seeing this or taking part in this for the first time. We're very proud of our new joiners, and we're really pleased to work with members of our public and organisations such as Healthwatch. Just a reminder, really, that an AGM is not just a statutory requirement, it's also a chance to reflect, to celebrate on our progress, and to reaffirm our shared commitment to excellent community care. And I can say with some passion that all of the examples of patient care that I have seen directly over the last year, and examples of hearing about our services at board, made me realise just what a special and committed organisation we are. So we can see the agenda in front of us. We'll begin with a look back at the year and the challenges we faced and the achievements we're proud of. We'll also hear from our Chief Executive, Elliot, who's on my left, and our Director of Finance, Director of Finance, Francis, who is our Director of Finance, and our Chief People Officer, which is Marcus. We'll also formally approve the annual accounts and review of last year's AGM minutes in a moment. And of course, we'll finish with a Q&A session. So please do post your questions in chat. And I'm not quite sure who's actually identified as. Are you going to be looking into the questions? Or yeah, you are. Yeah, lovely. So before I go any further, a big thank you to two people who really have a big place in our heart at HCT. To a big heartfelt thanks to our former Director of Finance, David Bacon, and to Alison Ryder, our former Director of People. They both retired from the NHS last year after many years of dedicated service, and their leadership and the teams that they led are a lasting tribute to their work and their commitment. As I said, I also want to extend a warm welcome to Francis Kacharian and our new finance officer, and Marcus Riddell, our new people officer. And they've already made an excellent start and have brought even more experience and energy to the organisation. So a big thank you to both of you for what you are doing and have done so far. So a little bit about housekeeping. The meeting is being recorded. Apologies, I didn't mention that before, and the link will be shared across all our channels. And if you'd like to review our annual report from 24-25, and the accounts of the minutes from last year's AGM, these are all available on HCT's YouTube channel. And I understand that we're getting quite a few hits on that, so that's really, really good to hear. Please keep your microphone on mute during the session. As I said, we'll have a Q&A at the end, but you're welcome to post questions in the chat throughout, and we'll address as many as we can. And if we don't get to your question today, please email us at hct.communications with an S at the end @nhs.net, and we'll ensure you get a response. So just going to the formal matters, I'd like to confirm that the minutes of last year's AGM meeting have been reviewed. So I'm asking people to hands up. Having some background noise. Anyway, well, should we just carry on? Hopefully it's gone. So can I just ask for people to actually approve those and support those? They've been posted. I'm getting quite a few nods. That's great. And next we present the annual report and accounts for 24-25. which I'd also like for approval. These documents, I know we've got to the accounts, we can't do until after you've presented, Francis, yeah. These documents provide a full and transparent account of the trust performances and our governance, and they've been reviewed by our board and audited as required. And as I said, later I will propose that the annual report and accounts be formally adopted by the trust once Francis has presented the finance report. So a little bit about HCT. I think we can talk about our vision, and you can see it there. And we're doing quite a lot of work at the moment, for those of you in the organisation, to actually refresh those and to think about how we can actually reflect what we are as an organisation and what the NHS needs from us, and as well as our patients. But for those that don't know, we provide a wide range of physical and mental health services to people across Hertfordshire and beyond. We deliver care in people's homes, in clinics and in schools and in the community. And we are quite a widely dispersed organisation now, which I think is important to say. So the advent of CSACE and some of the work we're doing, which is absolutely wonderful, takes us into many other parts of our region. We have a strong focus on prevention, early intervention and personalised support. And our aim is to get people to live healthier, more independent lives, closer to home. And although we're going to refresh our vision, you know, that caring, that bit about being agile, that bit about being innovative, I've seen so many examples, and we'll hear a little bit about that throughout the rest of the AGM. So move on to a short overview of the year from my perspective as chair. So I've been incredibly impressed by the clinical innovation that is happening in all parts of our organisation. And I'd like to make a big mention of both our adult team and what is going on in the virtual wards and hospital at home and our urgent communities responses. But I'd also like to highlight the fantastic work that we're doing in children's services, both in terms of more physical issues and also in terms of mental health. These are really highly motivated teams, and everything that I've seen over the last year confirms that. I've been so impressed by the dedication, by the way in which people are really motivated to give joined up care and to be innovative. And I think one of my highlights was also visiting some of our residential or inpatient units, which I think really do give wonderful care, as well as the stroke team, who also are really good. We're continuing to adapt to the evolving needs of our organisations, and I just want to thank everyone who has contributed throughout the year, and our clinical team, but also our corporate staff, volunteers, governors and board. Sorry, Suzanne, did you want to?
We're just trying to get the slide up.
Oh, right, don't worry. We've just got a bit of a technical problem. I have to say what I've just said doesn't really need a slide, but we'll get back into sync. So that's the first one. So we just need to go down to chair's overview. Brilliant, we're nearly there. That's right. Brilliant, there we are, we're there. Okay, so, you know, as I said, I've mentioned quite a few teams. And real apologies if I haven't mentioned so many other teams, but you know, on the ground, these teams are giving 101%. So a big thank you from me and all of the board. Okay, so next over to bring this to life, we'd now like to show a short video, which I'm hoping is going to appear on the screen. Are we all right?
I think so.
Are we having trouble making the connection?
Yes,
Okay.
with the YouTube video.
Check his
Yeah,
game.
it worked perfect.
Yeah.
Always the way, it always works perfectly in rehearsals and then. Yeah, honestly, had this perfect.
I understand why not.
I think it's actually worth just mentioning now that, you know, you and the IT team, you know, you've put a huge amount of effort into trying to get this to flow. And, you know, as you said, it just would be, wouldn't it, that on the actual AGM itself,
Exactly.
we're having a problem, but it's not through want of massive effort. So thank you. I'm just wondering whether we move on and then show it at the end. Is that maybe better to actually move on with the rest of the slides and go back to the video afterwards?
Yeah.
I think that's what we'll do. Yeah. So I think without further ado, we'll show the video later. I'm going to hand over to Elliot, our chief exec.
So, thank you. Thank you very much. So, as you said already, Nicholas, HCT, our vision is guides everything that we do. I think we are extremely patient focused as an organisation. We are extremely focused around the health of our population, and we do everything that we can to provide outstanding care and transform community health for those populations. Our purpose is simple, to support healthy lives close to home. And our values are lived out every day by our staff, shaping how we work with patients, families and each other. Again, review of the year around our 4 strategic objectives, which are up on the screen there. It's been a busy year for health services, as it always is, and I think we've continued to face significant demand for our services, significant numbers of increased referrals into our services, both adults and children. But I'm proud to say that despite these huge increase in referrals, we've delivered safe, effective and compassionate care to thousands of people across our community, which I'll come back to some numbers in a minute. Some key achievements that we've achieved during this time is expanding access to community nursing and therapy services, helping people to stay well at home, embedding new digital tools to improve the way that we work and communicate with patients, delivering strong outcomes in areas such as children's health, intermediate care and public health nursing, making progress on our green plan commitments to sustainability, really important for an organisation that does so many transport miles to visit people in their homes, and launched a new refreshed approach to staff wellbeing, shaped by direct feedback from our staff. These achievements are testament, as Nicholas has already said, to the immense amount of hard work from the staff, our support from partners across the NHS, local government, education, social care, and many other partners in the voluntary sector as well. So I think we're emerging from the year, I think, stronger, more connected and more ambitious about the state of and the future of community care and the part that it has to play, which I'll come back to in terms of where we go in the future. Just to highlight a few things on children and young people's as in terms of the numbers that we see, because I think it's really important to put it in some context. We did 107,000 initial assessments in the last year, which is a huge number of appointments and initial assessments, and then subsequent follow-ups from there. We have vaccinated 468,910 children, young people. Very specific about, very proud of the 10 in particular at the end of that. But huge numbers of children have benefited from vaccination. And in Cambridge and Peterborough, we had the highest rate of vaccination for MMR across the country. So, you know, in a very difficult, traditionally difficult area for people to get vaccinated in. So immense pride in those services. And indeed, we're now the provider for child health information service and child school age immunisation across the whole of East Anglia. We've had additional investment in dental services for children. Our vacancy rates in children's services have fallen from 19% to 9%, largely on the back of work that we've done to ensure that people stay in the first 2 years of joining HCT. And as a result of that, we've had reductions in therapy waiting times and extra investment to support that and support improved access and progress in those areas. We've innovated in those areas as well: children, young people therapies, digital referral and automation, won a NHSJ award, and allied to that, on the real quality side, we've attained the UNICEF Baby Friendly Initiative for the 4th year running. So I just wanted to highlight some of the work that we've done in children's. As you've mentioned, Nicholas, we've got 53 different services. I'm not going to mention everything, otherwise we'll be here for the rest of the afternoon. But it just highlighted some of the numbers, just huge numbers of people that we deliver will benefit to. We've delivered overall across all services 2 million care contacts, which is a huge amount, and a testament to the scale and the reach of our services. But we're not happy with that. We've launched a health and wellbeing bus to take our care directly out to communities and increase those number of appointments still further. And as I say, we've strengthened our partnerships and will continue to strengthen our partnerships across the healthcare system to make sure that we work more closely with GPs, with hospitals, with other community providers, and with councils to make sure that we provide joined up care as well as the voluntary sector. Operationally, we've delivered strong progress. I'll move on to the next slide. We continue to match our waiting time requirements, even though we've had huge numbers of additional referrals into the services, as I've already mentioned. But our urgent community response exceeds national targets. Our hospital at home service shows that most of the time we operate at about 138% over capacity in terms of the service that we provide to patients. And I think that is really key in terms of what public want, in terms of looking after relatives and loved ones at home, rather than always going into hospital when that's not the best place for them. The unscheduled care coordination hub has helped avoid admission for 84% of patients that have come in, and has again been shortlisted for the HSJ Digital Awards. So there are areas of some areas where we need to and want to improve our waiting times further, and we will continue to do that over the next year. But the teams have shown a real commitment to delivering consistent patient-centred care every day. Move on to so that's our review of the last year in very micro form. Go on for a long time about this. In terms of what we look for the future, the government has been really clear in terms of the 3 shifts in healthcare. One is from treatment to prevention. The second is from analog services to digital services. And the third is about from hospital provision to community provision. We didn't, but we could have written the government's plan for them in that respect, because they are the three of the key areas that we really want to be focusing on. We feel, as I've already said with the hospital at home, that treating people in hospital when it's right is absolutely brilliant and actually the right place to be. But for a large number of frail end of life and multi-morbid patients, being treated at home is a much better option, and a much better option for their outcomes than being in hospital. So we want to do more to support that shift out of hospital, both in the urgent care space, but also more in the proactive care space. I've mentioned about digital awards and our focus on digital transformation, and how we've used robots to make sure that we can, and robotic processes to make sure that we can automate as much as we can to make it as slick and as modern to get referred into HCT services. And also there's much more that we can do in terms of moving from sickness to prevention, not just in the children's space where the public health nursing team do prevention in the long term on a daily basis, but also in other services as well, where we can look at secondary prevention and making sure that people burden from illness is reduced and their treatment is as effective as possible. So We look forward to working with partners to enact the government's vision, which could have been ours. And we will continue to work over the next year and beyond that in terms of building a more sustainable future with our partners across the system. Thank you very much.
Thanks, Elliot. So something now that we're going to hear about, which is very dear to my heart, which is our shadow board, which was incepted a few years ago due to the real foresight of both Elliot and my predecessor, Linda Sheridan. And I think this is a truly remarkable achievement, and we gained so much from the shadow board. And I'm delighted this afternoon to be able to welcome Alison Wilcox, who is a really, a big member of our team and the shadow board. So Alison, over to you to give us a little bit more insight.
Thank you very much indeed. Hello, good afternoon, everyone. So my name is Alison Wilcox. I'm an occupational therapist and I currently work as the Clinical Quality Improvement Lead. I'm a member of HCT's Shadow Board, as Nicholas has said, and I've worked for HCT since 2008. And HCT Shadow Board did launch back in October 2022, and everyone in the NHS Trust was invited to apply. And having a Shadow Board in the NHS is quite trailblazing, so I'm very proud to be part of that. I'd like to tell you today who makes up the Shadow Board and some of the work we've been completing in the last year. So board membership. The Shadow Board are a very diverse group of staff spanning both the clinical and corporate teams of HCT. We collectively have significant experience and expertise of working in the NHS and connecting with both the general public who access our services and all of our colleagues. We have lived experience of disability, long-term conditions, neurodivergence, being carers, or coming from a Black, Asian or ethnically minoritized background, and really understand how these can intersect so we can really offer a wide perspective of items discussed by the Executive Board. This year, we're very proud we've refreshed our board membership and recruited more staff to ensure the Shadow Board truly represents the staff, patients, and also the population we serve through our diversity. Being a member of the Shadow Board provides an excellent opportunity for supporting leadership development within the Trust, and we really welcome our new colleagues onto the board. The HCT Shadow Board has also fostered the growth of staff networks by promoting diversity and inclusion and enhancing staff engagement and supporting well-being, which has increased psychological safety across the Trust and boosted activity and interest, importantly, in our staff networks. We're very proud that we've got 7 staff networks in HCT, the Armed Forces Network, Carers Network, Celebrating Racial Equality and Diversity Network, the Menopause Network, Proud to Be Network, and Together We Can Network, and lastly, the Young Staff Network. Hopefully I've mentioned them all. So, anti-racism, the Shadow Board has supported the Trust response to the 2024 racist riots by endorsing the Chief Exec's statements, offering to support to all staff via the HCT intranet, facilitating team conversations, and discussing the anti-racism action plan in our meetings to really ensure HCT remains an open, inclusive, and supportive organisation. The Shadow Board has also significantly contributed to the reduction in the 2-year recruitment and retention turnover rate from 20% to 12% through really comprehensive discussions, analysis over the past 2 years. This has included discussions regards the detailed reviews of the Workforce Race Equality Standard, that's RES, and the Workforce Disability Equality Standard, WDES data, and the gender pay gap, and also importantly, the Adult Services Review. Additionally, the Shadow Board has really analysed those retention rates, reasons for leaving, and internal promotions by protected characteristics, to assure you. By sharing our diverse experiences, the Shadow Board members have really offered valuable insights that have shaped the organisation's recruitment and retention strategies. This teamwork has really ensured that the approaches are inclusive and effectively address specific needs and concerns of all the staff members, contributing to the significant reduction in the turnover rate. And also the Shadow Board has continued to support the development of various corporate strategies this year and scrutinising operational transformation work. We have also had 5 joint board development sessions where the executive board and the shadow board work together on a range of issues to ensure all the voices are heard, and we all work with our system partners and stakeholders to benefit colleagues, patients and service users and our public. Topics that have been discussed have been the HCT strategy, a kind of a pathway programme called Proactive Care in -9, and how we also work with our stakeholders, and obviously recently the new NHS 10-year plan. Our aim is to ensure a real culture of understanding, empathy and collaborative work. Thank you for the opportunity to tell you more about the Shadow Board today.
So thank you, Alison, for that. I really feel that conveyed so much of the breadth and the detail of what the discussions that we've got into. And I think a mark of that is that, quite often we invite members of our shadow board to take part in board development sessions, and there's always a representative at the main board. And I would defy anybody to recognise who the shadow board member was, because the richness of the discussions that we've had because of their presence and the way in which they've contributed has, I think, been absolutely outstanding. So we know we're not perfect. We know that there's always more that we can do. This is a very complex area, but we're very proud of it and very grateful to all the members that have take part. So thank you. Okay. So without further ado, Frances, it's over to you to take us through the financial performance of the year, please.
Yeah, thank you, Nicholas. For anyone that I haven't met, I'm Frances and I joined in October. And I'm just going to talk you through some of our financial numbers and how our income and expenditure is being spent for the year. So this slide just shows the key financial figures that define our financial performance over the past year. It's intended to show metrics such as our revenue, where we've got 8% higher than 23-24. And it's just also provides you financial indicators of our fiscal health. So as you can see, we did 100k better than plan, and we did a 0.23 million deficit, and we did not reach our statutory use of break even, but that was an agreed control total. Staff costs, we spent £130.1 million. Some of the good news stories coming through with agency was 2.8 million, which is actually 40% better than the prior year. Our capital expenditure, we had 8.4 million, which we managed to spend, and it just shows how we spent that. 3.4 million of the 8.4 is a technical adjustment for how we value our leases, but the remaining £5 million is spent on capital equipment, IT infrastructure, and looking at our environmental sustainability programmes. And then we've also got our cash, which we ended the year at 13.4 million. This puts us in a good place for 25-26, but we are trying to focus on our financial sustainability. So these are statutory duties to hit our financial control total, which we did. We kept our capital resource limits, and also we managed our cash movement, so we didn't have to apply for any additional cash to pay anything outside our own balances. As Nicholas mentioned previously, the board has formally reviewed and approved the annual report and the accounts for 24-25. The board and the external auditors have confirmed that our reports are present and they represent a true and fair value of HCT's financial position, and the performance for the year complies with all our relevant statutory and regulatory obligations. So this is our funding sources. We've broken down how we are actually funded. So as you can see, we have different aspects. We get the significant chunk of our money through the ICB. And this is just paying for the core community healthcare services. And then we've got a next largest chunk coming through from our NHS England and our local authorities. The local authority is what the services that we have for public health nursing, our school nursing, and every kind of prevention-based programmes. And then we have the next chunk coming through NHS England, which is for our COVID and our immunisation. We also get additional income for education and research funding, payments from non-NHS providers, and charges to NHS other trusts for things like shared services and other charitable contributions. but it does show that we are not as heavily reliant on our funding sources from the ICB solely. We have a really diverse funding pool coming through. And next slide, please. So on the other hand, I think it's good to show where we spend our money. So not surprising, the huge portion is spent on our staff costs. In fact, 75% of our money out is spent on staff. If you put that in with our clinical supplies, actually 84% is actually being spent on staff and for patients themselves. So this represents our commitment to our quality of patient care. Obviously, other significant costs include education and training, which enhances our workforce skills. We also invest in our property and our infrastructure to maintenance. And then we have some of our outsourced services, which is things like speech and language. And then the next part is our depreciation of assets, which is just how our buildings, I guess, devalue over time. We manage our resources efficiently and we prioritise spending to support our operational goals. On staff. So without going into too much detail, what we've just tried to do is break down where our staff base is coming from. And this just shows the importance that we have and how diverse our staff base is made up of. What is one of the important things to look at is how we start to spend our money from 23, 24 to 24, 25. You can see that there's been significant improvement in our staffing substantive costs, which give a better quality of care. So we've almost halved our agency. We've seen that continue into 25, 26. On top of that, reducing down our agency, we haven't put it into our bank. We have actually maintained and reduced our bank in 24, 25. And so we've increased our whole time equivalent substantively. Thank you.
Thank you.
Try this video.
Yeah, should we try? Do you want? I'm just wondering before we try the video, can we just, because this is the right time to do it,
Okay.
can I just formally propose that the annual report
Yeah.
and accounts be formally adopted by the trust? So I'm just looking for nods of head, please, or raised hands, or whatever you want to do. I think I'm seeing lots of agreement. I'm not seeing any dissent. Thank you. So those formal approvals will be recorded in the minutes of this meeting. So before we go on to our Q&A, we're going to try again with the video, hopefully.
It's ready in a moment.
Okay, that's a good sign. We're ready in a moment. Okay. I know a lot of effort has gone into this, so we really do hope we can show this. We won't do the drum roll. Just
Play shortly, and we hope that the sound will also come out as well. So.
parents of a teenage girl who sadly died from cancer are appealing for people to use different language when talking about the disease. Alan and Chiara's daughter Daisy was diagnosed with a rare cancer at the age of just 12, and she passed away just over a year later. Now, Alan and Chiara are now urging people to avoid using the phrase losing the battle with cancer. This morning, they spoke to BBC Three Counties presenter Andy Collins. Tell us about this phrase then that we're talking about this morning, you know, that we hear all the time, you know, losing the battle with cancer. Tell us about that.
Yeah, I think it's very important because these are brave children that fought the battle through no choice of their own. They're not losers. We as a society have failed to equip them in the fight.
The students have really taken on board the things that they talk about in their sessions, the things they've learned about in workshops.
It's been really nice, and it helped me with how to manage my low self-esteem and then my anxiety a bit.
It helps me go into school since I'm usually anxious about that, but it gives me confidence knowing that people are there for me.
So for us, I think it's given us an insight into how Jack's brain works sometimes.
Some feedback, especially from parents, that we tend to get a lot of is just having that person to hear the voice and the stories of our families.
I was feeling very ill. I went down to the hospital and the hospital examined me and sent me home again and said, "You're fine, just ride it out." During the next week, I became very ill and my daughter rang 111. I was having trouble breathing. They said, "Go down to A&E." I couldn't make it down there, so she dialed 999 for an ambulance.
So the process is a member of the public will phone 999 or 111, who will then pass across to us. The job will appear on our screen and we'll have a look at it. We'll review the patient's notes and history, and depending on what they've said to the call handler and also what they've been graded as a category, with East of England they'll be coded between C1 and C5, C1 being our high kind of our cardiac arrests, and C5s being our lowest acuity jobs. So we'll review what they've told the call handler, and based on that information, we'll potentially say, actually, this is suitable for our community providers to look into, and we'll pass it across to the community teams. Get matrons out, get district nurses, get therapy teams or falls lifting teams out to these patients, which would be much more appropriate than an ambulance. And for us, save ambulances for emergency calls, but still getting help to those who do need it.
The most important aspect of the health visitor 6 to 8 week check is maternal and physical well-being. This is a great opportunity, usually in the safety of the parental home, to ask open questions that hopefully will elicit good conversational answers to important questions about overall physical and emotional well-being. It's really important to reassure that it's okay to not be feeling okay. Health visitors are in a good position to liaise with GPs or to refer on to specialist support such as NHS talking therapies. As this particular visit is often the last home visit that health visitors undertake, it's important also to give really good clear signposting to onward services and to make sure that parents know they can call us on the duty line if they need any other concerns addressing in the important and often vulnerable perinatal period.
Hello, my name is Gillian MacDonald and I'm the manager of Hertfordshire Community Pulmonary Rehabilitation Service. Pulmonary rehabilitation is a 6-week course of exercise and education designed to help people with a long-term lung condition become fitter and better informed.
Over the past few weeks, I have been out to every locality discussing the transformation and the community modelling, and have put up the Mad, Sad and Glad boards. Hopefully you've all had an opportunity to write down any comments, add your notes, and we're now in the process of collecting those back in again.
My previous experience being in hospital, obviously very different, where you on the ward, you don't do any traveling outside of hospital for your visit. Whereas here, you get to drive around, you get to see all this beautiful scenery, you see different patients on a daily basis, and they're all very, very different from different backgrounds, with different conditions and mainly elderly. The biggest insight of the job is how much you can give back into your local community.
We have a little piece of paper, which on here we have your height, your weight, your BMI, your blood pressure, your pulse, your oxygen sats and your cholesterol. And actually we also have a little box that says mental health. And what we're trying to find out is just how are you? How's your day going? Is there stuff at home or at work or both? Actually, you'd like some advice and guidance over.
I would recommend this check to everybody. It's very valuable and it does just, highlight areas that you want to work upon to ensure maximum good health.
In HCT, we're committed to supporting colleagues from minoritised ethnic backgrounds to develop and progress in their careers. Part of that commitment is demonstrated through our Thrive programme. Thrive consists of a range of personal and career development offers, specifically for colleagues from Black, Asian and minority ethnic backgrounds.
So I'm hoping I can be heard. A really massive thank you to the team that put that together. And if ever there were an example of the inspiration of the wide geographical and age groups that we serve, it is that film. And I think it really demonstrates how special all our teams are, awards and innovations across many of the areas that we work, and all done, or nearly all the time done, with a smile and putting in 101% of energy. And I think we should just pay tribute to everybody that were covered, or even if they weren't covered, that are contributing to this trust, which I find so exciting and really thrilling to work for. So thank you. Okay, we just go on now to the final part, which Hence, if we're going to get questions answered. Have you got any questions lodged?
No, nothing.
None at all. Okay. So, I don't know if anybody in the room wants to, or anybody wants to say something. Please put your hand up if you want to.
Roxana had her hands up at some point.
Who did?
Roxana.
Oh, Roxana, lovely. Roxana, do you want to say something?
Actually, it was, I didn't have my hand up. It was just to agree with something, but I just wanted to say what an absolute wonderful representation of our services that we've just seen, individual achievements of people and as an organisation as well. So well done, everybody.
Sorry, do you just want to say who you are? Because not everybody will know.
Yeah, absolutely. So I'm a non-executive director on the board for Hertfordshire.
Wonderful. And Roxana also chairs the HCT charity group as well, which is really, you know, we mentioned there, but really important. And we're hoping to do great things with it, aren't we? And I know there's a lot of work gone into revitalising that. So Roxana is an absolute integral member of our board and done great things. And I think Richard is also on there. Richard, well, do you want, if you're still on, you can wave your hand. Yeah, there we are. Okay. Do you want to say a bit about what you chair, Richard? Do you mind?
Yeah, of course, Nicholas. Hello, everybody. Richard Rolt, Ned, and chair of the audit committee. And a great set of presentations and a lovely video. So thank you very much, everybody.
Thank you, Richard.
Chris Ford and Sarah Lynn also on the call.
Who is?
Chris Ford.
Oh, Chris is.
And
I did. Apologies if I missed you there, Chris.
Hi, I'm Chris Ford. I'm a non-executive director and I chair the People, Performance and Finance Committee. And I agree with my colleagues. Fantastic performance on the video. Really enjoyed it. Once we got it, it was really good.
Thank you, Chris. Thank you for all the time you put into it. And finally, last but not least, Sarah Wren.
Hi, really great to join this AGM today, and I think it's fantastic that the film showed how we also try and live our values, and how the way that we behave is just as important. So I'm Sarah Wren. I'm another Ned, and I chair the Quality Committee.
Thank you. That's great that we've got all of our Neds here today to take part. So, are there any other questions? I just wanted to say a massive thank you for those of you that have dialed in. I hope you've been enthused in some way or other to realise what a special organisation everybody is working in. We exist primarily to serve our population, our patients, and everything that we do is directed at that. So if you have any comments or things that you would like us to address, or maybe an area of care that you may have had that you'd like to highlight, we're very happy to receive the comments, be it positive or maybe not so positive, because we believe in listening to patient experience, building on that for a better future. And we're really excited by the government's 10-year plan. As Elliot says, there's so much there that we could have written ourselves. And I'm not being too modest to say that a certain chief exec on my left has actually certainly been contributing to some of the thoughts and things that have gone into that. So we're here for you. We're really honoured to be your community provider in all the services that we do, and we hope to continuously improve throughout next year. Thank you.